After logging into the system, users arrive at their personal page. This intuitive interface helps staff and practitioners organize administrative and clinical workflows. The calendar feature enables you to assign tasks and set reminders for staff, while helping you streamline daily activities and respond to events in real time. You can choose to view your personal calendar in daily, weekly, or monthly format, and even sort your activities by title, start date, patient, or resource. Pending results provide ready access to labs, procedures, and radiology results for review and approval, eliminating the need to use paper or worry about lost results. Review of notes provides ready access to drafts of patient SOAP notes. Providers have the ability to review, update, and sign the notes, or share them with consulting physicians directly from their personal page. Practice Schedule provides instant access to enterprise-wide provider schedules, events, and conferences, while allowing you to easily store and share important documents, images, and multimedia presentations. Integrated Eligibility Verification enables staff to cross-check the patient's insurance plan for validity, thereby reducing the possibility of denied claims. With a single click, staff can search patients for appropriate location, provider, or payer, and process eligibility requests directly from the personal page. The Patient Response feature helps practices reduce patient no-shows by automating appointment confirmation, cancellation, and rescheduling. Appointment reminders are automatically sent to the patients via email. Responses are organized in a daily response bucket and sorted by patient name, appointment, date, and time to help you enhance productivity and increase patient satisfaction. Now, let's walk through a patient encounter to see how quickly and accurately CureMD EHR enables you to complete your documentation, while streamlining your unique clinical and administrative processes more effectively than ever before. To document the patient encounter, select the patient's name from the patient hot list and review the demographics. Patient demographics, such as name, age, social security number, contact information, and picture, automatically appear in this section. The Clinical Overview provides you with valuable tools to organize and document clinical information, including problems and complaints, histories, review of systems, vitals, physical exam, assessments, prescriptions, and immunizations. You can also access orders and results, clinical notes, and reminders. The Face Sheet provides a quick overview of your patient's documented clinical information, including diagnoses, medications, allergies, lab results, histories, and immunizations, along with a list of previous visits. Let's click on New Note to start the patient encounter. CureMD provides the most customizable note template available today. No longer are you forced to follow cumbersome documentation formats which do not speak your language. CureMD's configurable templates are custom designed for you at no additional cost to help optimize your clinical workflow without interruptions. To create the H&P note, simply select the appropriate report template and click Create. Since you decided to use your high-grade fever template, CureMD auto-populates the relevant clinical information, including problems and complaints, review of systems, physical exam, and prescriptions directly into the new note, saving time and effort. The Quick Review menu contains a complete list of your patient's medical information. This color-coded list enables you to distinguish between complete and incomplete information that can be added into the note. Let's use this menu to pull the patient's vitals recorded by your nurse. CureMD enables you to review and modify the vitals information, including temperature, pulse, respiration, blood pressure, etc., before accepting it to the note. In addition, CureMD provides immediate access to the patient's complete history, including family, surgery, social, allergy, medication, and other information for review, update, and inclusion. One click adds it to the note. Now let's review the problems and complaints that you auto-populated into the note. Simply click on the complaints to record further observations from your examination, including current status, pattern, duration, and severity. In this section, you can also add test results to further enrich your documentation. This information becomes a vital part of your encounter, facilitating effective and accurate clinical decision-making. You can now record your observations directly into the note. Click on the pre-populated Review of Systems to review and modify it according to your case needs. Simply select the respiratory system to review and update your findings. You can also preview the updated Review of Systems information before saving and accepting it into the note to instantly complete this section. Let's utilize the same simple method to quickly document the physical exam. With CureMD's point-and-click technology, check the appropriate physical and medical symptoms to complete your inspection of the patient's respiratory system. In just a couple of days, you will find this process to be much more efficient than writing. CureMD EHR's integrated imaging functionality allows you to further supplement your physical exam with relevant medical diagrams. Use the medical drawing feature to identify and comment on specific problem areas. While doing so, you are eliminating the need for transcription by automatically updating the patient's chart in your specified textual format. CureMD also allows you to create on-the-fly disease-specific templates that you can reuse to save time and effort while eliminating errors. These configurable templates provide further flexibility in documenting clinical information the way you want. Let's utilize the diagnosis template for fever to assess the patient's diagnosis. Simply review and update the current diagnosis before accepting it into the note. You can also choose a different diagnosis from the patient's diagnosis history, custom diagnosis list, or utilize the search feature to select from the built-in data library. CureMD EHR features computerized physician order entry, CPOE, for organization and administration of labs, prescriptions, radiology, and procedure orders and results. CureMD enables you to place lab orders and receive results electronically by utilizing HL7 compliant interfaces to conduct secure online transactions with participating laboratories nationwide. With CureMD, you also have the freedom to write, document, and transmit electronic prescriptions. Simply review the relevant prescription template for the patient's condition, update the desired information, and move on to check drug interactions. CureMD's drug interaction alert system cross-checks prescribed medication against other drugs, allergies, side effects, contraindications, and drug disease interactions, and displays color-coded warnings in case of potential allergic reaction or harmful interaction. You can link your patient to her preferred pharmacy and complete the prescription order while automatically updating the patient's chart. CureMD's integrated patient education provides your patients with a valuable reference base to help them gain a better understanding of their particular medical condition. CureMD maintains an extensive database of educational material on a broad spectrum of problems and diseases that you can easily update and customize to suit your patient's unique needs. This information can be added to the patient's note to document her level of understanding. Now that you have documented the encounter, you may assign your patient a follow-up visit. Using the Clinical Reminders feature, you can also record reminders for follow-up visits, appointments, recalls, lab reviews, and other tasks. CureMD enables you to save the note as a draft, sign it off, print or forward it directly for billing. CureMD is HIPAA compliant. Once you have signed your note, it cannot be further modified. However, you can append additional information and share the note among physicians for consultation and referral. Moving ahead, you utilize the eSuperBill to automatically process billing and other administrative transactions. CureMD's E&M coding feature automatically matches your documentation with appropriate level of service code to maximize reimbursements. You can update the eSuperBill to capture charges, add the appropriate diagnosis and procedure codes, and collect the copay. Congratulations! After spending just a few minutes with the innovative CureMD technology, you have achieved what only the top 1% of physicians in America do to exceed the nationally recommended clinical guidelines, documentation standards, and industry best practices.